Hello, my name is Ernesto Hernandez. I'm a student of physical therapy with the University of St. Augustine, and today I would like to present a case about a patient that I recently evaluated who was complaining of bilateral low back pain with prolonged sitting. In an article published by Akari Kitty et al. For the Journal of Safety and Health at Work in 2016, they reported that office workers who sat for a prolonged period of time at a desk were at higher risk of developing low back pain, possibly citing that they were using their passive structures rather than their trunk stabilization musculature to maintain proper spinal alignment. And so the purpose of this presentation, I will highlight the tissue impairments that are possibly contributing to this low back pain in a sitting position, as well as the functional ability and mobility that's being impaired by the tissues that are impaired as well, and finally the interventions that I would choose to address these impairments. My patient was a 27-year-old mesomorphic female who came to physical therapy complaining of bilateral low back pain when sitting for a prolonged period of time. She reports that she alleviates her pain by standing or walking when she feels this pain, and she's been feeling it for about 3 months. She reports that she feels this pain about an hour and a half in when sitting, and it begins bilaterally in her low back about L4-5 level to then radiating to her buttocks, and then with an associated tightness in her hamstrings, along with slight tingling in her posterior thighs once she feels the tightness in her hamstrings. Mechanism of injury for this occurred back in January of 2019 of this year when she went to pick up a heavy backpack off the floor and reported that she felt a sharp 4 out of 10 pain superficially on the left side of her low back. The pain that she reports now is still superficial and rather than deep. Back in January when she had that mechanism of injury, that pain resolved itself within about a week, although she did have difficulty bending forward and picking something off the floor. In order to alleviate her pain then, she reports that taking hot showers and doing her back stretches for her lumbar spine helped to alleviate her back. Now, 3 months later, she reports that it's long sitting that provokes her pain. Now, when she feels this pain, she stands up and walks around, and she feels that her pain goes away immediately. When she feels this superficial pain in her low back with sitting, she reports that it's at worst a 3 out of 10 pain, and at its best when she stands up and walks around, a 0 out of 10 pain. According to an article by Carcioglu et al. For the American Journal of Emergency Medicine in 2018, they reported that the numeric rating scale for pain had the highest sensitivity in clinical settings in patients rating their pain. Her past medical history is unremarkable. She took no imaging, nor did she go see her doctor about this pain. Although when she was 14 years old, she had a similar back pain that she experienced as at the same level, more or less, with a similar mechanism of injury, picking up a heavy backpack off the floor. And that pain was a 6 out of 10 that she reports from then. She did go see PT, where she was prescribed cat-cow exercises in quadruped, as well as double-kneaded chest stretches and child's pose stretches as well for her low back. That pain took 2 months to resolve, and she hadn't felt it since until this year. The Oswestry Disability Index was administered, and it has been validated by Kuroda et al. For the Oxford University Press in 2016 to have the best retest reliability in comparison to the Roland Morris Disability Questionnaire. The patient scored a 4 out of 50 on the Oswestry Disability Index, indicating that she has no disability. According to Deletto et al. For the Journal of Orthopedic Sports and Physical Therapy in 2012, their clinical guidelines suggest that with the low back pain that this patient is presenting with, the ICF categorization that they have for this presentation is acute low back pain with related or referred lower extremity pain. Their guidelines suggest that this is possibly caused by flat back syndrome, and the patient will report pain in her low back, buttocks, thigh, or lower leg areas, and that it is exacerbated by full range flexion activities such as sitting. Their guidelines also suggest that the patient will present that their pain is alleviated with postural changes or repeated movements. Upon my postural assessment of this patient, she presented with a decreased lordotic curve, as well as a posterior tilt of the pelvis and a left lateral shift of the shoulders over her pelvis. Upon performing PIVMs, I found that she had hypomobility in L3, L4 to L5S1 segments in side bending, both left and right, with no elicitation of pain or tingling, as well as hypomobility at the L3, L4 segments to L5S1 in rotation, both left and right. Again, not eliciting any pain or any of her tingling sensations. Also, I apologize for her active movements, forward bending, side bending to both left and right, and rotation to left and right proved to be restricted for her, and she reports having tightness in her low back, but no elicitation of pain in her low back or buttocks or tightness in her hamstrings as she reports before. An assessment of the lower quarter was performed as well, and I found that she had tightness in her bilateral hamstrings. Manual muscle test was conducted for her abdominals, presenting with a 3 out of 5 grading in strength, and a lumbar stability test proved to be unremarkable. Also, a neurovascular test was performed, and none, including the slump test or straight leg raise, seemed to provoke her tingling sensation that she reported in her posterior thigh. My PT diagnosis for her would be hypomobility in lumbar facets or low back pain with referred lower extremity pain using the International Classification of Function. My long-term goal for her would be 6 weeks to be able to sit for a prolonged period of time, driving for work or sitting in class, and not feeling any pain whatsoever for any duration of time. Now, for my impairment list and their corresponding interventions is going to be in ranking of highest priority to lowest priority. For my first impairment, I chose facet hypomobility in lumbar segments, and my intervention I chose was to perform manipulation of those segments, grades 3L4, grades 3 to 4. And it's been according to Zia et al. For the BMC Complementary and Alternative Medicine in 2017, they found that spinal manipulation for hypomobile facet joints proved to improve mobility of lumbar spine, as well as help decrease pain and increase functional ability in patients with low back pain. My next impairment that I chose was hamstring tightness, which I will address with PNF stretching. And an article by Kumar et al. For the Indian Journal of Physiotherapy and Occupational Therapy in 2015, they found that PNF stretching, specifically the contract-relax technique for the hamstrings, proved that there was an increase in hamstring flexibility as well as decrease in lumbar pain with patients with non-specific low back pain. My third intervention that I chose was neuromuscular control by means of motor control exercises engaging the local musculature. It has been validated by Anand et al. For the Indian Journal of Physiotherapy and Occupational Therapy in 2015 that motor control exercises did help decrease pain and functional ability in patients with mechanical low back pain. Finally, I will address her postural alignment by means of patient education on proper postural spinal alignment, and has been validated by Kumar et al. For the Indian Journal of Physiotherapy and Occupational Therapy in 2014 that not only does exercise alone improve spinal alignment and decrease pain, but also accompanied with education proved to have the best outcomes for these patients. My prognosis for this patient is excellent in that she actively exercises twice a week. She has no remarkable medical conditions. She's young and she's motivated to decrease her low back pain. Finally, according to Gashi et al. For the Sport Mont in 2019, they highlighted the importance of PT in the role it plays in relieving low back pain. And it's important that us as therapists, we address these low back pain patients, but from multiple impairments, multiple interventions, not just addressing one impairment. Because when you have chronic low back pain, you do have multiple impairments that may be contributing. And it's important that not only do we address all these impairments, but especially educate these patients on having a newfound level of consciousness of their pain and how to best to alleviate it. Thank you, and that concludes my presentation.